All right. Hey, my name is Toyosi Onwuemene. I am a hematologist and I specialize in disordered bleeding and clotting, hemostasis and thrombosis disorders. And today I want to talk about when should you reach out to your friendly hematologist. So there are three main reasons why you would need to reach out to your hematologist. Let's start with the one that is really, really straightforward and obvious. The patient has a known hematologic disorder. Very, very simple. Patient has hemophilia A, or they have sickle cell disease, or thrombotic thrombocytopenic purpura. So those would be reasons where you know the patient has a hematologic disorder. Go ahead and just get the hematologist involved up front. And they may say, great, thank you for letting me know that this patient with hemophilia A is here in the hospital for surgery, and they would like to be involved with you to help you manage the patient. Or they may say, this is a patient who's here with acute on chronic sickle cell pain. We think you should be able to manage it, and you agree. That's a good time to clarify that with a hematologist. So if they have a known hematologic disorder, it is customary to reach out to a hematologist and just make sure you're not missing anything and just ask, are we appropriately managing this patient in light of their underlying hematologic disorder? All right, that's reason number one. Reason number two, why you should consider reaching out to a hematologist is when there is a hematologic issue that you do not know the answer to. Okay, now everybody has different levels of comfort with hematologic disorders. Some people, if there is even a mild anemia, you want the hematologist on board, and that's okay. As hematologists, we're here to help you. We think about blood disorders all the time. And so, yes, it's probably going to take us a shorter time to get to the answer than it will you. But if you're comfortable, and sometimes I have providers who'll tell me, I take care of patients with acute vaso-occlusive crisis all the time. I don't need a hematologist to help me manage pain. And that's important. So I think you got to know your comfort level. But if there is an underlying hematologic issue, there's an anemia you can't explain, there's a thrombocytopenia you can't explain, there's a leukocytosis you're not sure of, you should definitely reach out to your neighborhood hematologist. Okay. The third reason to reach out to your neighborhood hematologist is when you want a procedure done that you can't do yourself. And that's mostly a bone marrow biopsy. When you think a bone marrow biopsy is indicated for a patient, for example, a patient with cytopenias, you should reach out to the hematologist and ask for their recommendation. Now, here's what's interesting. Sometimes I'll have people call me and they'll say the patient needs a bone marrow biopsy. I will tell you that's not a great way to consult your hematology colleague. You really want to say why you think that the bone marrow biopsy is going to get you an answer that you don't already have. The reason this is important is sometimes people have reached out to me and they've said, hey, this is a patient who has pancytopenia, clearly needs a bone marrow biopsy. But this is a patient who was getting methotrexate and had methotrexate toxicity. In these patients, we expect that they have pancytopenia, and we expect the pancytopenia to run its course and recover. In patients like that, we would not necessarily put them through the bone marrow biopsy if there's a clear etiology of their cytopenias, and we know that there's going to be a recovery soon. Okay, so that's one of the reasons why we may not do a bone marrow biopsy. So I want to ask that when you reach out to your friendly hematologist, help them understand how they can best help you. Try not to be specific about like, oh, you got to do the bone marrow biopsy. That's the only reason we need you, but allow them to help you manage this hematologic condition with you, because really your hematologist is there for you and is there to serve you and your patient. And you should make sure that you get the maximum benefit from your experience with a hematologist. All right. It's a pleasure to have talked to you today. Thank you for listening. I'll talk with you next time.